Hi, my name is Deanna Harris, and this video is for Nursing 224. Nursing 224 medication administration. So what I would do first is I will go ahead and perform hand hygiene. And once I perform hand hygiene, then I will grab my MAR and grab my physician's order. I will make sure that the provider's order matches up with the MAR and make sure that there are no discrepancies between the two. There are no discrepancies between the two. So then I will make sure that the patient is not allergic or have any contraindications regarding the medication that they are getting ready to receive. I see that there's no contraindication. So now I will look to make sure that the MAR and the prescriber's information is correct. I make sure that the patient's name, so I see that his name is Leon Hall. His date of birth is 8/10/1981. I'll make sure that that I have the correct medication, the correct dosage, the correct route, and that the time is now to be given now. I will make sure that I will check the bottle to make sure, or the label on the medication to make sure that the label and the medication matches with what I need to give. And so patient is due for acetaminophen 500 milligram tabs or tab for his pain, for his wound on his leg. And then he's also due for Humalog 5 units, so for insulin or insulin 5 units subcutaneous. So once I find that, I'll make sure that I'll check the labels, make sure that the medication is not expired or anything like that. And then once I do that, I'll make sure that all the calculations are correct. And because I'm giving insulin, I will make sure that another nurse can check over, or will check over, and make sure that my calculations are correct, that the medication is indeed the medication that I need to give for the patient. So once I do that, I will grab the needle. And then once I do that, I'll inject the needle to get the medication. And once I get the medication, out, and I fill it up, then I will do a one-hand scoop. Let's see there, a one-hand scoop to recap my needle. And then I will also grab my oral medication that needs to be taken by mouth, the acetaminophen. And I'll grab that, and I will not open it until I get into the patient's room. So once I gathered all my materials and supplies, then I will go ahead and go into the patient's room. So I will knock, identify myself. Hi, my name is Deanna. I'll be your nurse for today. And here's my patient. I know normally I wouldn't do this on a in the clinical setting, but because of my space here, I need to move some things. So I will introduce myself. My name is Deanna. I am your nurse for today, and I am going to acknowledge the patient's name, or have them to state their name and their date of birth. And so patient's name is Leon Hall, date of birth is 8/10/1981. Okay, great. And so I will just come in and I will let them know, we're going to go ahead and administer your medications today. And one medication will be the Humalog, or the insulin 5 units. And that's going to go subcutaneously. And then we're also going to give you the acetaminophen 500 milligram tab. And I just want to double check and make sure that you don't have any allergies, and that you're not allergic to anything. Patient says no. And then I'll educate the patient. The reason why we're going to go ahead and give you the insulin is because your blood sugar was elevated, and so we're going to go ahead and try to bring that down with the insulin medication. And then we're going to give you the acetaminophen for the pain that you experience from the wound that's on your leg. And so I will educate the patient. Is it okay that I go ahead and administer the medication? They tell me yes. They give me a verbal order. Do you have any questions, concerns that I can assist you with? No? Okay, great. So then I will go ahead, and while I am raising the bed up to a hip level, and raising the head of the bed at least 30 degrees, I'm assessing the patient. I'm looking to see if there's any vital sign changes. I'm looking at any vital sign changes, any difference in breathing pattern, anything like that. So then I will also ask the patient what medication you would like to get first. Okay, and you express that you want to get your insulin first. So I will go ahead and ask the patient if I can roll up the gown so I can expose the abdomen area. So once I do that, and expose the abdomen area, I will assess the abdomen area for any like rashes, any lesions, any skin discoloration. So there's no lesions, no rashes, no irritation, no drainage in the area. And at the time, I'll also look to see if the patient can swallow, and the patient can swallow. So after I do that, I will go ahead and perform hand hygiene again. And then I will go ahead and don some gloves, some clean gloves. And then I will go ahead and let them know that I'm getting ready to touch their abdomen. I will let them know that I'm going to pinch the area, and make sure that all the area is that I can pinch it, okay, and that I can. So once I do that, I will go ahead and clean the site. And the site will be 1 to 2 inches away from the umbilicus. So I will go ahead and clean the site with alcohol, and then I will allow that time to dry. And then once that dries, I'll go ahead and uncap my needle, and then I will take it and I'll let the patient know that I'm getting ready to pinch that portion. I'll take my non-dominant hand and pinch that portion, and then I will go in quickly between a 45 degree or 90 degree angle. I'm going to choose 45 degrees. I don't know if you can see that here. Okay, and then I'll stick quickly. I'll release here. I'll take my non-dominant hand to hold the needle steady, and then I will push with my dominant hand, and then I'll go ahead and release quickly. And once I release quickly, then I will apply a cotton ball to the site to apply pressure and kind of agitate that area so the medication can go in quickly. So once I do that, I will lift the cotton ball and I will assess the area for any redness, any swelling, any bleeding, any reaction to the medication. And once there's no reaction, once I see that there's no reaction or swelling, anything, then I'll go ahead and apply a Band-Aid. And then I will discard the cotton ball and discard everything that I need to discard. I will, once I take the cap off of this, I will not recap it. Once I'm done with this, I'll go ahead and discard this in the biohazard. And so now that I have done that, I will go ahead and now open up the package of acetaminophen. I will check again to make sure that this is the right medication and right dosage. I'll compare it again to my MAR, and this is the right medication, this is the right patient, this is the right dosage for this patient. So once I do that, I will go ahead and give the patient the acetaminophen, the tablet, and then go ahead and also give them some water so they can go ahead and take that down. I'll also look and make sure that the patient is not choking or anything of that nature from the medication. Once I see that they have swallowed the medication, I'll go ahead and take my gloves off. I'll remove my gloves and I'll go ahead and perform hand hygiene. And I will make sure that the patient is comfortable, make sure that they tolerated it well, and I will discard everything within its proper place, and then I will lower the head back down. I'll go ahead and lower the bed into the lowest position possible. Make sure that the side rails are up. Make sure that the bed is locked. Make sure that the patient has a call light beside them, and make sure that their comfort measures, that they're okay. Is there anything that I can do, anything else I can do for you? And if the patient says no, then I'll go ahead and perform hand hygiene and exit the room. I hope that this video clearly explains what I would do for medication administration.